Hello, and welcome to Agents of Nonprofit. My name is Alexander Lapa, and I'm speaking with everyday superheroes helping nonprofits using technology. Joining me today is Kelsey Fisher from the GAIA Global Health. Kelsey, welcome to the show.
Thanks so much, Alex. Happy to be here.
So, for those listeners who are hearing you for the first time, can you explain a bit about what you do and what GAIA does, please?
Yeah, I'd be happy to. So I'm Kelsey Fisher, and I am a program and grants officer at GAIA Global Health. I've been with GAIA since April of 2021, so a little over a year and a half now. And I work specifically on our health workforce development programming, which will make more sense once I go into what GAIA does. So our mission essentially is strengthening healthcare in underserved African communities. GAIA envisions a world where health outcomes are not determined by who you are or where you live. And we believe that everyone deserves access to quality healthcare, no matter where they live or who they are. We work in partnership with government and local communities to strengthen health systems by filling gaps in the healthcare grid now and increasing capacity for the long term. It wouldn't be fair to talk about GAIA without sharing a little bit about our history. So I'll cover that briefly, but we were founded in 2000 by Episcopal priest Bill Rankin and renowned neurosurgeon Dr. Charlie Wilson. Bill and Dr. Wilson launched GAIA. Back then it was known as the Global AIDS Interfaith Alliance, to increase health equity globally and to bring life-saving treatment to one of the countries most impacted by the AIDS epidemic, which was running rampant at the time, especially in sub-Saharan Africa. So yeah, we're a nonprofit. The US team is based out of California in Oakland, but we have an amazing team in Malawi, and we're actually technically separate nonprofits. So the US team provides support to our Malawi team in the implementation of their programming. And yeah, I'm happy to go into our programming in a bit, but that's just a little taste of who we are and what our mission is.
And why Malawi?
Why Malawi? Great question. So Malawi, again, was one of the countries that was most impacted by the AIDS epidemic when GAIA was founded back in 2000, but it was also one of the countries that was receiving the least amount of funding at the time. So Bill Rankin and Dr. Charlie Wilson, they had been doing work in a number of countries in sub-Saharan Africa at the time, but realizing that Malawi wasn't having as much attention by the global community and there wasn't as much funding being directed to the country, that was selected as a focus area.
What was the motivation for you to join GAIA? Like you said, you joined about a year ago, just over a year ago. So what was your experience before that, and what made you attracted to GAIA?
Yeah, I moved back to the Bay Area where I'm from originally about 2 years ago. I had been living in Washington, D.C. for 6 years prior, working at a number of different internationally focused nonprofits, but with different focus areas. So I had worked at an organization that was more focused on like children's rights and protection. I had also worked at an organization that was focused on supporting asylum seekers who had been persecuted by their home countries. And prior to that, I was working at an organization that was doing human rights research and publishing like articles and papers around human rights abuses globally. So my focus has always been international work. But when I moved back to the Bay Area, I was looking for a nonprofit that had a mission that really spoke to me. And global health, of course, it's undeniable. Everyone should have access to health as a basic human right. And so, yeah, it kind of fell into my lap. And then once I met the team and understand the mission a little bit better, it just felt like the perfect fit.
Yeah, it's a very admirable mission. I mean, yeah, I agree. Everybody should have basic healthcare, and it should be free too. That's one of the fortunate parts of being in Canada, at least for the most part of the year. The healthcare may
Yeah.
not be perfect, but at least it's free.
Exactly. Yeah, we could learn a thing or two in the US.
So then you mentioned Gaia focuses a lot on partnerships with people and with organizations in Malawi. Can you speak about, how does it accomplish this healthcare mission?
Yeah, definitely. So, I mean, partnership, I love talking about partnership because it's absolutely critical for any nonprofit. As an organization doing work anywhere, you can't work in a silo. Key to program success and sustainability is securing buy-in and working in partnership with the communities that you're serving because they know what's best for them, as well as the government. So all GAIA program interventions are implemented and developed with key input from the community served and implemented in partnership with the government of Malawi, the Ministry of Health, and the program that I support, local universities, as well as health regulatory bodies. But in terms of how we actually are implementing our mission, GAIA has two primary program areas. The first is community-based healthcare and is health workforce development, which is the program that I support. But just to touch on community-based healthcare at kind of a high level, the core of this program is bringing healthcare to communities where health facilities are limited, and chronic conditions are on the rise in those communities. And so this program is really about bringing healthcare where it doesn't exist or where services are super limited. And one of the main ways that we do that is through mobile health clinics, which provide primary health care to meet the needs of the local community where infrastructure doesn't exist. And so that's a really impressive program. We actually have these vehicles that go out on regularly scheduled days. They're staffed with medicine, medical equipment, things like vaccinations or like HIV testing supplies. And they're staffed with healthcare workers, and they go out to these rural communities and they, set up camp. And those community members know when those mobile health clinics are coming because they have regularly scheduled days. And so they can rely on those services on a weekly basis. And then in the program that I support, Health Workforce Development, this is all about building health infrastructure or healthcare infrastructure for the long term by educating and training health workers. So in Malawi, there aren't enough nurses specifically to serve the population. So we focus on graduating nurses through comprehensive scholarship support so that more nurses are out there serving the population. And the reason why we focus on nurses is because in low and middle income countries, they're often the only providers of care, especially in rural areas. So there may not be a physician in a rural health facility providing services to those communities. So nurses really serve that critical role. And so, we have a nursing scholarship program, which provides wraparound support for students who come from economically disadvantaged backgrounds. And these scholarships are provided for the full course of their training program. So if they're in a 4-year program, we're going to provide tuition support, living stipends, nursing supplies, psychosocial support, as well as licensure support when they graduate so that they can enter and be retained in the local health workforce. And one key component of this program are service commitments. So when we provide nurses with scholarships, we will also have them sign an agreement saying that they commit to working in Malawi for the same number of years that they were sponsored to ensure that they actually are being retained in the local health workforce. Another key part of this program is our fellowship programming. So one challenge in Malawi and, in many countries is the government may not have enough resources allocated to hire health workers in public sector facilities. And public facilities, of course, are, often providing free services. So they're serving the more vulnerable communities. So if there's not enough government resources allocated to hire health workers, those positions remain vacant. And there are nurses that have graduated who maybe are sitting idle and they're looking for work, but they're struggling to find it. So this fellowship program provides paid work opportunities in public sector facilities so that nurses can fill gaps in those health facilities, but they can also continue to build their skills until they're able to secure permanent employment. Yeah, so that's kind of the gist of the Health Workforce Development Program. Definitely a mouthful. I'm happy to answer any questions about that.
Definitely. I'm curious to know then, going back to the partnership or linking the partnership side of things, the partnerships that you have, I guess it would involve being able to provide all of these different portions, right? The tuition, the live-in, supplies, support, service commitment. Like you have to establish and maintain, and I guess you have to create a lot of new partnerships as well to be able to provide all of these services? Or is it more like you've established them already and now it's just nurturing those partnerships, making sure that they are able to complete their part of the deal?
Yeah, that's a good question. I mean, GAIA, so I'll speak to the Health Workforce Development Program since that's the program that I work on. But, this program has been around since 2005. So we have quite a track record and history of partnership building in Malawi specifically to make this program a success. So some of those partnerships are pre-established and it's all about ensuring that our partners can really see the value of GAIA and the impact of our work. But I mean, we also are always looking for new partners. So one example is in 2021, we secured a large award to grow this program. And that included forming partnerships with new nursing schools, for example, to establish this scholarship program there. And so that's a big effort to formalize those partnerships. But the good news is, I mean, GAIA has been around for so long. Many of these nursing schools, for example, are aware of our scholarship programming. So we're often, when we approach a new partner, it's often received really positively because we are supporting the students at their school to complete their courses. And especially in schools where maybe there aren't like loan options available, scholarships may be the only way that students can continue their nursing education. So yeah, I mean, just to say, partnerships are everything really for GAIA. We can't implement any of our programming without partners. And we work really closely and collaboratively with partners to ensure that we can implement and to ensure that there's buy-in, because we need to have the buy-in of the local community to be able to accomplish our mission.
But it sounds like you've got a very good reputation locally there, so that when you do start the conversations with new partners, your reputation precedes you, I guess.
Yeah, I mean, I think we definitely do have a good reputation in Malawi, where we've been for, 20 years now, not only with like training institutions, like I mentioned, but with the Ministry of Health and with the local government across the different districts of Malawi. Yeah, I mean, seriously, we would not be able to accomplish anything without partnerships. And having and maintaining those partnerships with the government is really key. I mentioned sustainability earlier, but our mobile health clinic program, so that's on the community-based healthcare side. The ultimate goal is for the Malawi government to kind of absorb that program and to fund it. And so we're really working toward that, which means really nurturing that relationship and inviting Ministry of Health representatives to see our programming, which we actually just had a visit by Ministry of Health officials a couple of weeks ago. And that was huge because they're visiting to see our services. And our hope is that, eventually the government will take some of these services on to ensure that long-term sustainability.
This might seem like not a dangerous question, but is there any concern that because you're providing this service that the government can take a step back and say, well, we don't need to do it because GAIA is doing it? Or do you think that they're actually being motivated by your mission to say, we need to take over this, we need to absorb GAIA and continue it so that GAIA can move on to, let's say, the next country?
Yeah, I feel like that's a really good question that we that we think about as well. And it's certainly a question that, potential funders think about. And yeah, I mean, I think that that is definitely something to reflect on and to consider. But the fact of the matter is that, we wouldn't be providing these services if they were already being provided. And there's still a huge need. So I think, one could pose that argument. But in response, I think our team would say, well, of course, the ultimate goal is for the government to be providing these services. But until then, we're going to be doing that, because if we weren't providing these services in these areas, they wouldn't be provided. And that has really devastating effects on the communities that rely on these mobile health clinics to provide primary health care to them, to provide HIV testing, vaccinations, support to new mothers and their babies. So yeah, that's definitely something that I think we think about, and I'm sure a lot of NGOs that are doing international work think about. But at the same time, you have to weigh like what would happen if these services weren't being provided.
Yeah, for sure. You mentioned also investors. I was curious to know, how do you find investors? Are they international, mostly based in the US? And how do you reach out to investors, let's say?
Yeah, fundraising is a core part of any nonprofit's work. It may not always be the most fun or favorite part of the job description, but it's absolutely necessary, because without funding, we couldn't accomplish our mission. So, I mean, GAIA has a range of support from different types of funders. So we have a robust, loyal individual donor base. We have some local, like, faith-based groups out in the Bay Area that provide our or that support our work. We also have US government funding. That was the award that I was talking about earlier when we touched on partnerships and building new partnerships because of this large award that we received. And then we also have funding from different foundations. But I mean, the process of securing that funding, it's a lot of work, right? It's all about relationships and partnership building. And I think fundraising, these days is especially about like maintaining relationships and instilling trust in the funders that you're approaching, and also being able to just demonstrate real concrete impact with numbers that back up what you're saying in terms of successful interventions. So yeah, I mean, we have funders that have worked with GAIA for, a long time, since the early days when we were founded. But we're always looking to secure new funding and to diversify our funding, just to ensure long-term sustainability of the organization. More recently, GAIA has been talking about expansion outside of Malawi, so replicating some of the programs that we have currently, specifically health workforce development programming and the nursing scholarship program specifically. And so that's involved different types of conversations with funders, because we can demonstrate our impact in Malawi, but we don't have a footprint in neighboring countries, for example. So how do we show that this program can be replicated and that it will be effective in a new context? So yeah, partnership building, just going back to that and why it's so important. It's not just with partners that are helping to implement our activities, but also partners that will be funding those activities.
I mean, it's a wonderful mission. So in approaching fundraisers, then I imagine one of the things you want to communicate to them is certain numbers. How many people you have in the program, for example, in this healthcare workforce development program. How many people you're serving, how many have graduated. What kind of reporting and analytics do you guys provide to your funders?
Yeah, that's a great question. So, and I'm sure a lot of nonprofits can relate to this. So, being a nonprofit is all about, or being a good nonprofit is all about being able to measure impact. And when it comes to demonstrating the impact of health-related programming specifically, you need real concrete numbers to be able to say that interventions work. to also be able to demonstrate that programs are sustainable, and like you said, to be able to secure funding partners. So at GAIA, we are constantly collecting and analyzing data to be able to do this. We do this internally to ensure that we're on track to meet our goals, and we do this regularly to be able to report to funders. One example of an internal exercise that GAIA does is our completion of a quarterly dashboard to measure progress against our annual indicators, which is then presented to our boards, both in the US, and our Malawi team presents it to their local Malawi board. And this presents an opportunity for our boards to ask hard questions, and questions that, in our day-to-day work, we may not be thinking about because we're so into the activities. But yeah, it's a really good exercise that I personally enjoy doing because it keeps us on track in terms of progress toward indicators, but it also allows us to take a step back and reflect, like what is working and what isn't working, and how does the data show that. But I mean, in terms of numbers, I can speak to the Health Workforce Development Program a little bit better. But we're talking about basic numbers, but then we're also talking about numbers that get into more of like the nitty-gritty about the impact of the scholarship program. So we track things like how many students are currently enrolled and being supported with scholarship support, and where are they at in their nurse training program. We track numbers about the number of scholars that have graduated, the number that have been licensed. We also look at whether students are graduating on time and how long it takes for them to get licensed, whether or not they have to take licensure exams multiple times. We also track figures around completion of the post-graduation service commitment. So what I mentioned earlier. So, the number of scholars that are remaining in Malawi for the same number of years that they were sponsored. We track figures around the number of scholars that have remained in Malawi just generally, so even beyond that service commitment, which is really impressive. We have 99% of graduates that have remained working in Malawi, and that is out of a total of 536 graduates to date, which is a huge figure. And then we also track details around like fellowship programming. So how many scholars have been awarded fellowships? How many have received specific types of training within that program? How many have gotten employment, like permanent employment, either during the fellowship or after fellowship completion? So lots of different, I think, to demonstrate this program too, we really talk about employment, and the ultimate goal is for our nurses to graduate and secure employment and to be serving the most vulnerable communities. So how many of the nurses that we support graduated on time, got licensed on time, were employed within 1 year of getting licensed, and how many of them are working in public health facilities serving the most vulnerable communities, for example. Yeah, I mean, I have figures readily available for that, and we're continuing to update those. So just to name a few, 99% of scholars remain working in Malawi, 81% are employed in the public sector serving vulnerable populations, 98% of scholars complete their post-graduation service commitments, 91% of scholars graduate on time, and nearly 100 pass their licensure exams. These are figures for 2021. And yeah, I mean, those are just a few. On the community-based healthcare side, figures are really important there as well. And these numbers, we present them on like a really granular basis, but then over time, since like mobile health clinics have been operating, for example, and some of the data points that we collect there are mobile health clinics, like what is the percentage of them operating on the regularly scheduled days, for example. And in 2022, mobile health clinics operated on 97% of regularly scheduled days. And then, in instances like this, we'll then take a look at, well, what happened on the 3% of other regularly scheduled days? Like, why weren't we operating then? One reason for that in 2022 was flooding that occurred in Malawi that prevented mobile health clinics from reaching some of those remote, hard to reach communities. On that program, we also track like total visits since the launch of the program in 2008, which surpassed 2.5 million midway through 2022, which is just, I mean, jaw dropping. And then we also track a lot of specifics around like conditions that are being treated at the mobile health clinics. And like, how are those conditions related to key health outcomes and Ministry of Health goals in Malawi? So yeah, again, rambling a little bit, but we track a lot of data, and it's absolutely critical for responsive nonprofit work, especially in a global setting.
These are actually very impressive numbers, but there's one particular stat I was hoping to hear, and I wanted to make sure I understood it if you didn't mention it already. If someone is joining and they want to become a nurse, and it takes, for example, 3 years to do the program, I understood that 98% stay for the 3 years after that program to commit. It's a one-to-one commitment. What about people after that 3-year program, post their promise or commitment to stay? Do you know approximately, or do you have a number for how long, or if they stay in Malawi after that point?
Yeah, so yeah, you understood that correctly. 98% of scholars complete their post-graduation service commitments. And the stats that we have present are 99% of scholar graduates remain working in Malawi. And I mean, that includes those that are under service commitment, but also those that are beyond that service commitment. So we have very few instances where nurses are leaving the country. And if they are, it's often to pursue like additional education, additional nursing education, for example. So yeah, I mean, the track record of individuals staying in Malawi is really, really impressive, especially since, you know, during the wake of COVID, there's been a lot of, how do I say it? I don't want to use the word, well, okay, recruitment. There's been a lot of recruitment by higher income nations have been like approaching nurses and healthcare workers in countries like Malawi or neighboring Zambia, for example, to recruit nurses to fill gaps in their healthcare workforce. So the fact that, you know, our nurses, the nurses that GAIA has supported are remaining in country is just a stat that I know that we're very proud of.
It's actually quite impressive, because I imagine the temptation is alluring to move to another country and, you know, possibly get more significantly more salary because of that. So I'm really impressed. So those are wonderful figures to have. This is actually a lot of data as well. So I'm curious to know, how do you track all of this stuff?
Yeah, so we use a number of different tools, and you know, there's tools that we use that are more on the technology side, but then we also use a lot of like kind of basic tools like Excel for tracking. On the health workforce development side, of course, we use Excel and different tools like that, but our most effective tool, I would say, where all scholar and fellow related data is stored, is Salesforce, which is the primary kind of project management tool and just data tracking and storage platform for that program. On the community-based healthcare side, they use a few different tools, but the main like data collection tool is ComCare, which is used to collect like electronic health information for individuals or different populations that are served. But yeah, on our side, or on my side with health workforce development, Salesforce is the primary tracking tool.
Do you know why Salesforce was chosen as a CRM as opposed to anything else?
Yeah, I mean, when Salesforce was selected, it predates me a little bit, but you know, in talking to my boss why it was chosen, and now being kind of like the primary user and manager of Salesforce, it's clear to me why it was chosen. I mean, well, I'll start by saying that GAIA uses Salesforce in a way that I don't know whether like all nonprofits use it. We don't use it in like a fundraising capacity, although we are considering that in the future. We use it more or primarily as a project management tool. And I know that it was selected because it is effective in doing project management, but also because it's customizable. So again, this predates me, but when Salesforce was adopted as the tool for health workforce development tracking, it was completely customized to GAIA's needs at the time, which was a huge, benefit to using Salesforce to track our data. And so I know like just flexibility to like accommodate all of our needs was a huge selling point. Of course, the reporting feature is huge. I use Salesforce for, nearly all of our scholar and fellow reporting. It's easy to report and pretty user friendly. I know a selling point also was like the ability to like the communication feature. So at one point we were using Salesforce to send out like messages to our scholars, and then those messages were like recorded on their profile so we could see how often we were communicating with students. And I think just the ability to easily collect and store and report on data over time. So, when we're thinking about service commitments, the ability to track whether individuals are completing their service commitment is dependent on the ability to track data over time. And so Salesforce offers that feature. And yeah, it's absolutely critical just to be able to demonstrate the success of our program. So I think those are a few reasons why Salesforce was chosen.
And I'm pretty sure that the Salesforce instance that you have predates also NPSP, which is the nonprofit cloud that is very common these days for nonprofits. I'm curious to know the users of Salesforce, are they all in the US or do you have some in Malawi as well?
Yeah, that's a great question. So we have users both in the US and Malawi, and we have a few staff members who are working on the Health Workforce Development Program that are, supporting data entry and directly going into the system and making edits to scholar profiles. And I'm really hoping to transition a lot more of those responsibilities to our team in Malawi as a way to ensure long-term sustainability of the programming. Our Malawi team are the implementers and they are leading these programs. So as the experts of those interventions, they are best positioned to be adding scholar data. So yeah, we do have users on the Malawi team that are using the tool as well.
And if I remember correctly, you don't actually have anybody, like any nurses themselves, for example, updating their own profile. It's all controlled through the users using Salesforce in Malawi.
Correct. Yeah. We don't have any nurses that are updating their own profiles.
So the reason why we know each other is because, of course, I'm helping you with some of your, let's say, deficiencies in Salesforce or issues that you've had. Can you talk a bit about those issues? Let's start by asking the question, as you're using Salesforce, it's been around there for a while. You've noticed that there was a couple of glitches in the matrix. What was the point where you realized that it wasn't working for you anymore and then you needed to get help?
Yeah. So when I started at GAIA, my boss, Beth, who is amazing, really focused a lot of time and effort in training me on how to use Salesforce. I had never used the platform before. And so I, on my own, spent a lot of time playing around with the system, doing some like mass uploads and adding or updating profiles manually to kind of see how the system worked. And in doing so, and me having so much time to really focus on the database and learning it, I noticed that some of our like processes or flows weren't functioning correctly. So, if we added data to a particular part of a profile, or in Salesforce speak, an object on an individual's profile, and that was supposed to trigger some sort of like process. So for example, if we added like a grade on a scholar's profile for their third year of their training program, they should automatically then move to the next grade level, so their fourth year of their training program. So I started noticing like glitches in some of those processes that were supposed to be like automated on the back end. And Beth and I, we I would say did a pretty good job of trying to fix some of these things on our end, but we are by no means Salesforce experts and by no means experts on like updating kind of the back end processes. So at that point, we realized that we needed to reach out for some external support because those like automated processes are absolutely crucial in each student's like trajectory, whether they're in their program or they've graduated. So if the data is not updating their profile correctly, we can't report on the program correctly, which of course impacts everything. Not only our ability to like plan internally, but also our reporting to donors and reporting to partners. So yeah, the fact that processes weren't working correctly, and it wasn't for all processes, but for a few that were pretty important, that was a little scary because, not knowing whether the data you have is, completely accurate is troubling. So at that point, we reached out to somebody for external support and we found you.
I'm curious though, before you found me, what was your initial idea of, how to get help? Someone in your situation that, doing their best to make it work, doing some manual fixes, maybe doing a bit of back end stuff, realizing that this is a bit beyond them. Where was your first step to look for help as a nonprofit?
Yeah, so we initially reached out to a company that had helped GAIA customize the database to begin with. So they, we had worked with them before, but granted, we hadn't worked with them in a couple years by the time we reached out most recently. But yeah, we first approached them and they, are an awesome company, but had too much on their plate at the time. So they provided a few referrals. And those referrals were provided, those referrals, we had kind of a mixed bag. Some were companies that were larger and maybe used to working with organizations that have bigger budgets. But, GAIA, we're a small nonprofit. So we kind of needed to go back to the drawing board and see who had experience working with nonprofits specifically and what was a little bit more flexible maybe with their budget. And so yeah, that's kind of the process.
Once those issues have been solved, where do you hope to take Salesforce next? What would be on your ideal roadmap for Salesforce after that? You mentioned fundraising at one point. Is that something you see possibly down the road for you in Salesforce?
Yeah, I think it requires definitely like more internal discussions and planning to figure out like if that's the path forward. But it's definitely something that GAIA is considering. We've historically used a platform, which I'm sure a lot of nonprofit professionals are familiar with, Blackbaud or Razor's Edge, to track, donor communication and fundraising activities. But I think long term, it would be ideal to have that, our fundraising integrated with Salesforce. I think it seems like just a more user-friendly like CRM just in general, but also just having all of those activities like integrated in one spot would be just ideal for the organization. I think there's also, you mentioned the Nonprofit Success Pack. I think that's something that we've considered as well. But yeah, I think, to be honest, like Salesforce, it seems like the possibilities are really endless. So I think there's a lot of ways that we can use it to like improve, impact tracking and just like program operations in general.
I love asking the question what people don't like about Salesforce, because I know it is quite powerful. You can extend it and customize it and personalize it to any way you want. But I'm curious to know, what have you found as a challenge in using Salesforce?
So yeah, I think one of the challenges that I've noticed is that if you're going to customize Salesforce, you really want to do it right the first time, and it needs to be built out in such a way that if Salesforce, releases new ways of doing things or like improvements that you want to incorporate, the Salesforce database needs to be built out in such a way to be able to accommodate those new additions. And what I think we found through this process working with you and your brother, Alex, is that, there were some things that like we weren't sure why it was built out in a particular way initially. And going back and resolving some of those things like now at a later date can be a challenge. But I think in terms of like day-to-day issues with Salesforce, I can't really think of too many. I really enjoy using the database, and I think it's pretty easy to use now that I've like gotten my sea legs. But yeah, I mean, I think it's a really great platform, and it's really served our needs so far.
You're not alone. People do complain. The most common complaint, let's say, is a steep learning curve. But once you get there, like you said, once you find your sea legs, and I like that expression very much, it does become it becomes much easier to use. I mean, it becomes one of your tools in your toolkit again. So for people hearing about this and who are inspired by your mission, how can they get involved? How can they become a donor or contribute in some way to Gaia?
Yeah, I love this question. Yeah, I mean, I think I would love for more people to get involved with Gaia and just the mission in general and, advocating for healthcare as a human right. One way to do that is to to educate yourself and to get familiar with healthcare inequities globally and maybe specifically in sub-Saharan Africa where Gaia works. I encourage anyone listening to visit our website. I can do a little plug here, www.gaiaglobalhealth.org, and Gaia is GAIA. There's plenty of materials on our website to read up on. We also have our strategic plan there and annual reports to learn a little bit more about our work and our history. Of course, donating is always welcome and is a really powerful way to contribute to organizations' missions, because without donations, we cannot implement our work. Yeah, I mean, working in Malawi, we don't really have like volunteer opportunities per se, but we are, planning events locally, and we want to grow just our supporter base. I think one specific focus area that we have right now is also growing our Gaia supporter group among young people and getting young people engaged and getting young people excited about sharing what Gaia does and the challenges related to health that are faced around the world, specifically in Malawi and neighboring countries, so that people know how lucky we are in higher income countries to have access to services. So yeah, but I would say step one, visit our website or follow us on social media. You can get to our social media by going to the website. We have Instagram, we have a LinkedIn presence, Facebook, all that. And we're always trying to post really engaging content around both of our programs and just around health outcome information as well, whether it's the fact that certain countries are achieving goals set forth related to health outcomes or challenges that are being faced globally.
We'll put all those links and social media links into the show notes at the bottom. So thank you so much. Kelsey, it's been awesome. Thank you so much for being here today.
Yes, thank you so much, Alex. It's been my pleasure and really appreciate you and your support of Gaia and just helping us to improve our systems. Thank you.
That's my pleasure. All right, then, that's it for today. I'm Alexander Lapa, and I hope you join me again in the next Agents of Nonprofit.